I did not ask for a report to sugarcoat what the issues are. I asked for a report to identify the problems, and that's what we've received. And I intend to act on these issues. That's what I intend to do.
That was Mayor Barrett responding to concerns about problems within the health department.
So we have Alderman Russell Stamper and Michael Murphy with us. So who's running the health department now, and how should taxpayers be concerned about what's happening there? Because this is an important agency.
Well, it's critical, and right now we don't have anybody running it, so we're looking to have an interim director, and currently Paul Nannis is the nominee, but I don't expect him to be approved on Tuesday, so it'll be incumbent on the mayor to offer an alternative candidate, or the council will have to take action. But I can't say strongly enough the importance of having somebody in there to help correct the current problems, but also point in a direction for the future.
Do you have any suggestions?
I have some suggestions I've shared with the mayor, but I think the council will have to either take its own steps appropriately, or the mayor will submit an alternative.
Where you stand on this, because this agency not only doesn't have a leader right now, but there's a lot of vacancies.
There are, and we have to fill those vacancies. But also, there are a list of names that have been presented to the president of the Common Council. So we look to go through those names, present some names for some qualified people who are interested and who care about our community.
Let's go back to the point you were making earlier.
Sure.
Children. This is all about the children.
Absolutely.
What needs to be fixed, and can it be fixed?
Yes, it can be fixed. We have to get to those households, let them know that their children were tested with elevated blood levels.
Notify them, or what?
Well, letters have gone out.
Yes.
And we've opened up clinics, and people have been coming to get tested. 286-8800 is a number of people can call and get more information. But as Alderman Stamper indicates, a lot has to be done. At least 6,500 kids were not properly notified to determine whether or not they need follow-up. There was 2 very serious cases where children were having chelation process. They removed the lead from the system, and they were put back in a home where the problem wasn't corrected.
Yeah.
Those type of things have to be immediately addressed.
Yeah.
And those are things that the health department is required to do. But there's also this protocol that they have with the different levels of lead exposure. And what has been, I think, conflicting or confusing for some is understanding we've gone from 500 to 6,000 to 8,000. We want to know how many children really are impacted by what could have been a mishap at the health department.
There is no clear distinction. That's why it's important that we get to every household. And other than those solutions that Alderman Murphy presented, we are going to go door-to-door campaign. Maybe a community-based organization can respond to an RFP that we're developing to go door-to-door to inform those children and those families of the services and resources that are available.
Now we do have experts on here who say that it's important to have the water filtration as well as replacing those lateral lines. You guys are responsible for saying yes or no to the budget to get those lines done. Are you guys reevaluating that and the timeline?
Well, we are looking at more of a comprehensive approach at trying to address all those issues. But keep in mind, just looking at removing the lead pipes in our city would be about $750 million. That's a pretty staggering sum of money where our budgets are pretty tight already. But we have increased the amount of money this year from last year. Is it to my satisfaction? Is the pace of replacing it? No, but that's going to be trying to get either federal or state additional assistance to help the taxpayers.
So that is a big number, but when you look at the cost of what the impact on children
and
the long
lives.
term, these are lives.
Yes.
And you can't put a dollar number on
Absolutely
that.
not.
So is there a solution to replacing the lateral?
Yes, there is, and it's in place. Right now it's on a year-by-year basis, but it has to
It's a long time period, though,
It's
right?
a long time period because there are a lot of homes that have to be replaced with lead. Laterals have to be replaced. So it's just physically, it's going to take a long time. And money-wise, we need more revenue. But we can work on those filters and get the filters in the households as soon as possible.
Just a few seconds left.
Yeah, and it has to be a comprehensive approach too. I think when you talk to your experts, you're going to find it's not just the water as a source of contamination. It's from lead paint, from in the soil, it's from the gasoline. So when we spend our limited financial resources, we want to do it in a wise and an efficient manner.
Do you think you'll have to, though, decide maybe this section of the city will wait another year to get this other section of the city that's more impacted by the lead in the water first?
I think we have to prioritize, and I think that's where good science will help really make that determination.
And this
we
is a
have
heavy
with
lift.
the daycares. The daycares have been our priorities. So they're almost complete.
It is a heavy lift for the city. Does the federal government have to do some of the lifting as well as the state?
We welcome them.
But are they there?
No.
Well, Gwen Moore has asked for the CDC to investigate, and she's also said that it's going to take a federal.
But in terms of the dollars to fix the problem.
Yes, we need that.
But
Yes.
the money is not there.
No, it's not.
And we need a reauthorization of the Clean Water Act, which would provide additional resources to cities across the country. Milwaukee's not alone on this problem.
Alderman, we appreciate your insight.